Morning. The next topic is innovative therapies transforming dry eye treatment. The current treatment with the artificial tear for dry eye patients, which provide only the temporary symptomatic relief and does not address the root causes and pathologies like inflammation. Ideally, the aim of dry eye treatment should be not to progress the disease in a stage causing ocular surface damage because it's a late manifestation. So the current treatment is more focusing to treat according to the pathology than only the signs and the symptoms. Now we have some drugs acting at different levels and sites of pathological cycles of dry eye. Most of them are under experimental stage, some are released and FDA approved. Another important point to remember is both aqueous deficient dry eye and evaporative dry eye may coexist in a single patient. These are not completely separate conditions. According to the current recommendation, we can treat dry eye patients with the artificial tear. And for meibomian gland dysfunction, we can give topical antibiotics and systemic antibiotics according to the severity of the disease. And for both, we can give a short course of topical steroids like loteprenol if it is associated with inflammation. Cyclosporin is another commonly available anti-inflammatory molecule we are commonly using for the dry eye. But now we have some modifications in the molecules like nano-emulsion formulation combined with the perfluorobutyl pentane and micellar nanoparticulate formulations. All these can decrease ocular side effects, increase tolerance to become faster onset of action and increase bioavailability. Lifitegrast is also available here. It's an anti-inflammatory molecule which inhibits T cell adhesion and reduce inflammation. This also will take up to 2 weeks to 3 months to relieve the symptoms like cyclosporin. That means it will take time to act. Tacrolimus can be used, which is available as ointment here, which can be used instead of cyclosporin if the patient is not tolerating with the cyclosporin molecule or poor response with the cyclosporin. Coming to the newer targeted therapy, the upcoming drugs, some treat signs and symptoms or some increase the production of tear or it can act as anti-inflammatory or repair damaged ocular surface. Coming to the some molecules, one is riproxalap, which is a reactive aldehyde species inhibitor. The importance is the presence of reactive aldehyde species on the ocular surface indicate oxidative stress. It's there in the dry eye. Another molecule is licaminlimab, which is an anti-TNF alpha eye drop, which acts as anti-inflammatory. It can be used in dry eye disease and also in uveitis. This perfluorohexyloctane, which is a drug for symptomatic relief, it's already FDA approved. It's specifically for evaporative form of dry eye. It's a water-free, preservative-free, and amphiphilic molecule which forms a monolayer which stabilizes the tear film when it is applied over the ocular surface. So it reduces the evaporation of the tear and it can be used in cases of evaporative form of dry eye. The next concept is neurostimulation. The drug is varenicline, which should be administered as a nasal spray. When it is administered inside the nose, it stimulates trigeminal nerve and stimulates lacrimal secretion and increase the production of tear, sebum, and mucin. The topical secretagogues like decaphosphate tetrasodium, ribamipide, and oral secretagogues like pilocarpine increase the secretion of this tear in cases of severe form of dry eye. Another concept is this activation of thermoreceptors. That means the drug name is acotrimone. When it is applied over the ocular surface, it activates cold sensing thermoreceptors and generates cooling sensation, which trigger the production of basal tears and decrease the symptoms of a patient. So it is developing as ophthalmic drops, and cryosim act in a similar way, which should be applied over the lids. Visocolmitide, which is very helpful for regeneration of the ocular surface. It is a collagen mimetic peptide which repairs selectively diseased or damaged collagen and restore the structure and function of this ocular surface if it is damaged due to the dry eye. Next is topical selenium sulfide, which act as keratolytic and keratostatic agent and slow down the progression or rate of keratinocyte proliferation, which is very helpful in MGD, which can act against demodics and also bacteria. It is hypothesized that the one cause of MGD is duct orifice keratinization, so this drug can reduce the incidence of this duct keratinization. It is developing as ointment. It should be used twice weekly to improve meibomian gland function. Another drug is lotilaner. Actually, this demodics organism causes blepharitis, which can be treated with tea tree oil. Lotilaner is a new drug, which is a lipophilic agent, acts specifically against mites like demodics. It should be used twice daily for 6 weeks. Rinsada is an irrigating device. It is using to irrigate on the ocular surface, which decrease inflammatory mediators and decrease the symptoms of a patient temporarily. There are many molecules are coming up, like thymosin beta for neurotrophic keratitis, senigermin, and visometine, which is a topical synthetic mitochondria targeted antioxidant. Carbonized nanogels, lacretin, lacripep, which stimulate the basal production of tear. Dietary and lifestyle modifications are very important to prevent the development of dry eye and in the treatment of dry eye. Adequate sleep and hydration is very important. The food factors like lutein, zeaxanthin, and vitamin D are known to increase tear volume and increase the stability of the tear. High saturated fatty acids known to produce inflammation and it should be reduced. Food rich in omega-3 fatty acids having some anti-inflammatory property and should be increased in the diet. So for a dry eye patient, low carb, low fat and high fiber diet is recommended. Apart from the already established treatments like thermal pulsation, intense pulse light and low level light therapy, there is another treatment method called quantum molecular resonance electrotherapy, which produce and deliver electrical fields with high frequencies and low intensity, which appears to be in resonance with the molecular bonds in the biological tissue, which stimulate metabolism and produce regeneration. So it can decrease inflammation, stimulate meibomian glands, and enhance surface healing. Blood products are also very important in case of dry eye associated with the ocular surface damage. Commonly using ones are autologous serum and platelet plasma. These are rich in growth factors, which is very helpful to regenerate the epithelium. So it's very helpful in epithelial defect associated with the dry eye and also in neurotrophic properties associated with the dry eye. So the shift of management is the newer upcoming drugs going to change the treatment pattern. The clinical focus went beyond merely lubricating the eye to address the pathology of the patient. So when a patient comes, understand the pathology, find out the dominating mechanisms and causes in a patient. According to the pathology, give a targeted therapy or a personalized treatment. Multiple therapeutic targets should be addressed simultaneously for a patient. Drugs with a specific molecular targets and enhanced delivery system should be prescribed, aiming for improved efficacy, faster onset, and better tolerability. So the shift is from symptomatic relief to etiology-driven management. Thank you.